Canine Parvovirus, or Parvo as it's commonly known, is a highly contagious virus that poses a serious threat to dogs. This nasty virus attacks the lining of a dog's intestines, preventing the absorption of essential nutrients. This leads to severe dehydration, weakness, and in many cases death, especially in puppies. First identified in the late 1970s, Parvo quickly spread worldwide, becoming a major concern for dog owners and veterinarians. Parvo is a relatively new disease, which makes it even more frightening. Because it's so new, dogs haven't had time to develop natural immunity. This lack of widespread immunity makes it crucial for dog owners to understand the risks of Parvo and take the necessary precautions to protect their furry companions. Parvo is a serious disease, but the good news is that it is preventable. By understanding how Parvo spreads, recognizing the symptoms, and taking preventative measures, we can help protect our dogs from this devastating virus. Remember, knowledge is power when it comes to keeping our furry friends happy and healthy. Canine Parvovirus is a stealthy enemy lurking in the environment and spreading easily from dog to dog. The virus is primarily transmitted through direct contact with infected feces. This means that even a small amount of contaminated feces in your yard, at the park, or on the sidewalk can pose a risk to your dog. Parvo is incredibly resilient and can survive in the environment for months, even in harsh conditions. It can cling to shoes, clothing, toys, and even your hands. This is why it's crucial to practice good hygiene and always wash your hands thoroughly after handling any dog, especially if you've been in an area where dogs frequent. Indirect transmission is also possible, where the virus is carried on contaminated objects. Think of things like food and water bowls, leashes, collars, and even the hands and clothing of people who have touched infected dogs. This highlights the importance of keeping your dog's environment clean and disinfected. It's worth noting that Parvo can also be airborne for short distances, particularly in areas with poor ventilation. While direct contact with infected feces is the most common mode of transmission, it's essential to be aware of all the ways Parvo can spread. While canine parvovirus can infect dogs of all ages and breeds, some are more susceptible than others. Puppies with their developing immune systems are at the highest risk of contracting Parvo and developing severe illness. Puppies between 6 weeks and 6 months old are particularly vulnerable because their immune systems are still maturing. Unvaccinated dogs, regardless of age, are also prime targets for Parvo. Vaccines play a crucial role in providing immunity and protecting dogs from this deadly virus. Dogs who are stressed, malnourished, or have underlying health conditions are also more susceptible to Parvo. Stress and poor health can weaken the immune system, making it easier for the virus to take hold. Certain breeds, including Rottweilers, Doberman Pinschers, German Shepherds, Labrador Retrievers, and American Staffordshire Terriers, have been shown to be more susceptible to Parvo. The reasons for this increased susceptibility are not fully understood, but are thought to be related to genetic factors. It's important to remember that even if your dog doesn't fall into one of these high-risk categories, they can still contract Parvo. The best way to protect your furry friend is through vaccination and practicing good hygiene. Knowing the signs and symptoms of canine parvovirus is crucial for early detection and treatment. Parvo is a serious and potentially deadly disease, so recognizing the signs early on can make a world of difference in your dog's outcome. If you suspect your dog may have Parvo, seek veterinary attention immediately. One of the most common and telling signs of Parvo is severe vomiting and diarrhea. The diarrhea is often bloody and has a very distinctive foul odor. Along with these digestive issues, dogs with Parvo often exhibit a loss of appetite, lethargy, and weakness. They may seem depressed and uninterested in their surroundings. As the virus attacks the lining of the intestines, it prevents the absorption of nutrients and leads to severe dehydration. You may notice signs of dehydration in your dog, such as sunken eyes, dry gums, and loss of skin elasticity. Parvo can also cause a fever, often accompanied by shivering or chills. In severe cases, parvo can lead to sepsis, a life-threatening condition where the body's response to infection damages its own tissues and organs. If left untreated, parvo can be fatal, especially in puppies and dogs with weakened immune systems. Diagnosing canine parvovirus typically involves a combination of physical examination and laboratory tests. Your veterinarian will begin by asking about your dog's symptoms, medical history, and vaccination status. They will then perform a thorough physical exam, checking for signs of dehydration, fever, and abdominal pain. To confirm the diagnosis, your veterinarian will likely recommend laboratory tests, including a fecal ELISA test, which detects the presence of parvovirus in your dog's feces. Blood tests may also be conducted to assess your dog's overall health, check for dehydration and electrolyte imbalances, and monitor their white blood cell count, which is often low in dogs with parvo. Treatment for parvo is primarily supportive, focusing on addressing the symptoms and preventing secondary infections. Since parvo is a virus, there is no specific cure, but with prompt and aggressive treatment, many dogs can make a full recovery. Hospitalization is often necessary to provide intravenous fluids to combat dehydration, administer anti-nausea medication to control vomiting, and provide nutritional support. Antibiotics may also be prescribed to prevent or treat secondary bacterial infections. Preventing canine parvovirus is far more effective and less costly than treating it. Vaccination is the cornerstone of parvo prevention and is highly effective in protecting dogs from this deadly virus. Puppies require a series of vaccinations starting as early as 6 weeks of age, followed by booster shots every 3 to 4 weeks until they are around 16 weeks old. Maintaining a clean and hygienic environment is crucial in preventing the spread of parvo. Parvovirus is incredibly resilient and can survive in the environment for months, so regular disinfection of your dog's living areas is essential. Use a pet-safe disinfectant that is effective against parvovirus and follow the instructions carefully. Avoid taking your puppy to areas where unvaccinated dogs frequent, such as dog parks, pet stores, and grooming salons, until they have completed their full vaccination series. Even after vaccination, it's important to practice good hygiene, such as washing your hands thoroughly after handling other dogs and picking up your dog's feces immediately. Remember, prevention is always better than cure when it comes to canine parvovirus. By vaccinating your dog, keeping their environment clean, and practicing responsible pet ownership, you can help protect your furry friend from this devastating disease.